of the good people of Delta State to congratulate you on your appointment as a member of the Steering Committee of the Organization of Africa First Ladies for Development Upland as an appointment well deserved. Today is the day 2 of your visit to Delta State as you bring to the grassroots the triple elimination campaign of HIV/AIDS, syphilis, and hepatitis among women of reproductive age, which is tagged the Freeze to Shine program. The campaign is also the elimination of mother-to-child transmission and treatment of children born with HIV/AIDS. This event is timely as it complements the Delta State government in advancing the health needs of Deltans through the MORE agenda, especially pregnant women and children under age 5 in the state. The elimination of HIV/AIDS, syphilis, and hepatitis among women of reproductive age cannot be overemphasized. Therefore, all hands must be on deck to achieve this goal. I wish to use this medium to call on well-meaning individuals, organizations, and donor agencies to be part of this move to eradicate this plague. This will help in addressing the challenges of safe delivery of our women and the growth of our children. Finally, I believe that after this program, we will live in an environment where HIV/AIDS, syphilis, and hepatitis will be reduced to the barest minimum.
And mentors next. And finally, for children, we need to ask the children, all children of known HIV positive women, to be tested, and if positive, they should be put on treatment. Early diagnosis helps the children to grow normally and to live healthy lives and achieve their objectives in life to the highest level. Next.
15 years. I'm looking healthy, I'm okay, I am fine, and there's nothing wrong with me. But I want to use this opportunity to beg for something for people living with HIV and AIDS in Nigeria. You know, these antiretrovirals are every single day we take them. And being that you are on these drugs every day, they are taking a toll on our kidneys and livers. We need to have access to free testing for kidney and liver function. Because recently we discovered that so many of our people are coming down with kidney and their liver disease because they are not checking their kidneys and livers.
To assert, without any equivocation, that with interventions such as this Free to Shine program, Her Excellency Senator Oluremi Tinubu, CON, is truly renewing the health of Nigerians and helping to secure a healthier future for our country. Intervention to end TB in Nigeria, to reduce the burden of cervical cancer in our country, improve nutritional status of our people, upgrade the livelihoods of many Nigerians, has become an invaluable component of the Renew Hope agenda of President Bola Ahmed Tinubu, GCFR. Your relentless commitment to bringing together key stakeholders and harness political commitment at the highest level in the pursuit of the noble goal of improving the health and productivity of Nigerians has been phenomenal, and it is catalytic in helping us to get things done in the health sector. I wish to therefore appreciate you, ma'am, for your passion, your dedication, and commitment, which is giving Nigerians, especially women, children, and youths, the leverage to shine, free from preventable diseases and from poverty. Today,
Her Excellency Senator Oluremi Tinubu, CON, and the Organization of African First Ladies for Development deserve commendation for the renewed drive to tackle the spread of HIV/AIDS among women of reproductive age, elimination of mother-to-child transmission, and treatment of children born with HIV AIDS. This is a giant step forward towards addressing the gender-sensitive concerns of sexually transmitted diseases and sexual and reproductive health issues as highlighted in the Beijing Declaration of 1995. And as government, we shall complement the effort of the First Ladies of Africa by ensuring that women are continuously empowered to make decisions for their economic and physical well-being. You will recall that the Beijing Declaration of 1995 advocated for increased policy and program investment, including skills development, to expand female participation in all strata of the economy. I am pleased to inform you all that the empowerment of women is one of the cardinal objectives of my administration mole agenda. Your Excellency, you will recall in August 2024, I intimated you of our modest effort to empower the women folk through the More Grant scheme for petty traders, artisans, and female entrepreneurs. That we have done, and I believe this year we'll do more of that this year. We believe that as more women achieve financial independence, they will be in a better position to make better decisions regarding their choices in life. Hence, we consider ourselves partners with Your Excellency and Offland in the campaign against these public health challenges. On this note,
So the Free to Shine campaign is an advocacy initiative led by the African Union, the Organization of the African First Ladies for Development and Global Partners. The goal of this campaign is to address the growing complacency in the response to the spread of HIV/AIDS in Africa, Nigeria being the country with the highest burden of HIV/AIDS in sub-Saharan Africa, due to its large population, faces significant challenges. This burden is particularly severe among children, youth, women, and marginalized. TB is no killer. Just make sure you get treated. Please, those two, because they are contagious, you have to get treated. That's why we are here today. But I'm so glad that our young people, and I see them just looking at, as if they are invisible. So please, we have to do what is right. To complement the Free to Shine campaign, I've also decided to advocate for the triple elimination of HIV/AIDS, syphilis, and hepatitis by 2030. The campaign will cover 6 geopolitical zones of the nation. We launched the maiden campaign for the North Central Zone in Kwara on 30th January 2025, and that of the Northwest Zone in Kaduna on 2025 February and 25th February 2025. Today we are flagging off the campaign in Delta State for the South-South Zone. By the grace of God, the next zone to benefit will be the Northeast, and Taraba states will be the host. The Free to Shine campaign seeks to significantly reduce new HIV infections among women and reproductive age, prevent mother-to-child transmission, vertical transmission, and ensure that every child born with HIV receives the necessary treatment for support to thrive. According to the federal, the goal of this campaign is to raise awareness, renew our commitment, and take collective action against these diseases. This, I believe, aligns with a shared vision of a healthier Nigeria where every individual, particularly women, youth, and children, can thrive and live healthier lives. This vision is in line with the renewed hope agenda on health of His Excellency President Bola Ahmed Tinubu GCFR, which focuses on health as an essential pillar of development. Nigeria is at a pivotal stage in her fight against HIV/AIDS and is poised and ready to join other countries in Africa who have achieved the UNAIDS 95/95 target by 2030. The aim of this target is set to see that 95% of the people who are living with HIV/AIDS know their status. 95% of those who are aware of their status are placed on life-saving antiretroviral treatment, and 95% of people undergoing treatment achieve viral suppression, which means they cannot transmit the virus to others.